Hello, this is Akram Jafar, and today I'm going to deal with the renal system, concentrating mainly on the kidney. The two kidneys are part of the urinary system. Urine flows from each kidney down its ureter to the bladder and then to the outside via the urethra. The main function of the kidney is to filter the blood and return most of the water and solutes to the bloodstream while excreting wastes and foreign substances. The ureters transport urine from the kidneys to the urinary bladder, and the urinary bladder stores the urine. The urethra is for the discharge of urine. Please differentiate between the ureter, which extends between the kidney and the urinary bladder, and the urethra, which is the urinary passage distal to the urinary bladder. Each kidney is a bean-shaped organ, and they are found just above the waist, and they are located in a retroperitoneal location behind the peritoneum. Look at this section here of the abdomen. It's a horizontal section of the abdomen. You can see that some abdominal structures, like the liver here, is almost completely covered by peritoneum, and these are called intraperitoneal structures, while other structures, like the kidney, for example, they are just covered by peritoneum from the front, and so they are called retroperitoneal structures. The kidneys are located just above the waist, and the right kidney is a little bit pushed by the big liver. The liver, the wedge-shaped abdominal organ that mainly occupies the right hypochondrium, pushes the right kidney a little bit down. That's why the lower pole of the right kidney is a little bit lower than that of the left kidney. And note that the upper pole of both kidneys is related to an endocrine gland, the suprarenal gland. This is a dissection showing the right kidney. Look at the medial side of the kidney. This is called the hilum of the kidney, and it is where structures pass in and out of the kidney. It's an indented structure. The structures are mainly the renal vein and the renal artery and the ureter. This is a part of the renal artery entering into the right kidney, and this is the ureter. Here's the suprarenal gland, and note that the kidney is surrounded by renal capsule, which is transparent connective tissue, and outside this fibrous capsule there is a lot of fat, adipose capsule, which is called the perinephric fat, and then it is encased in fascia, which is called the renal fascia. Look at this side. The renal fascia has not been removed, and the perinephric fat is still there, so you are not able to see the kidney, but here they are dissected, so you can see the kidney surrounded by the renal capsule. There is a lot of fat surrounding the kidney. This is for protection of the kidney, and at the same time it allows the kidney to move a little bit with respiration as the diaphragm descends down, but mainly the fat is for the protection of the kidney. This is the longitudinal section of the kidney, and you can see that the parenchyma of the kidney consists of a renal cortex and a renal medulla. The cortex is the outer portion and the medulla is the inner portion, and consists of like cone-shaped structures which are called the renal pyramids. They have a tip called a renal papilla, and the renal papilla projects into what we call the calyceal system, the drainage system of the kidney. This is the site of the hilum of the kidney, where you can see blood vessels as well as the ureter entering into the kidney, and the space is called the sinus of the kidney. It is stuffed with fat as well as the branches of the blood vessels. The fat comes from the fat that is present around the kidney, the perinephric fat. So let's look again at the drainage system in this plastic model. You can see that it starts at small cup-shaped structure into which the renal papilla, which is the tip of the renal pyramid, projects. These cup-shaped structures are called minor calyces, small calyces, small cups. 2 or 3 of them, they form large cups, which is the major calyx. So 2 or 3 minor calyces form a major calyx. 2 or 3 major calyces form a funnel-shaped structure which is called the renal pelvis, or the pelvis of the ureter, and this narrows down to form the ureter. The junction here is called the pelvi-ureteric junction. Look at the ureter here. It's about 25 centimeters in length. It starts at the pelvi-ureteric junction, which is a site of natural narrowing of the ureter, and then as it crosses the site of bifurcation of the common iliac artery, it gets kinked, and this is another site of narrowing. And then as it passes into the wall of the urinary bladder, because it is surrounded by smooth muscle fibers and it has an oblique course within the wall of the bladder, then this is the third site of narrowing of the ureter. You would expect that if there is a ureteric stone, then most likely the ureteric stone will get impacted in one of these three sites. Let's draw the intramural portion of the ureter that passes within the wall of the urinary bladder. Here is the urinary bladder and the urethra. You can see the ureter here. It has an oblique course within the wall, which is highly muscular wall. There are a lot of smooth muscle fibers, and these will cause narrowing in the ureter. This intramural course is, in fact, it has a functional importance, because when the urinary bladder contracts during urination, it will expel the urine through the urethra, but some of the urine will try to reflux back into the ureter. Because the ureter has an intramural portion, this reflux is prevented because the urinary bladder squeezes the intramural portion as the wall of the bladder contracts.